These are the facts every adult over 60 needs to know about the 2025-2026 flu season, a season that has already sent more people to the hospital than any flu season in over a decade, with older adults bearing the heaviest burden. By the end of this video, you'll understand exactly what's happening, why this season stands apart from recent years, what symptoms to watch for, which vaccines offer the best protection, and when you need to pick up the phone and call your doctor. Let's get right into it. The 2025-2026 flu season has turned into one of the most significant in recent memory. During the last week of December, doctor visits for flu-like illness climbed to 8.2%, and that number represents the highest level since 1997, nearly 30 years ago. Moderate severity is how the CDC has classified this season overall, but the numbers paint a far more serious picture. Mid-January 2026 estimates from the CDC put the total at 18 million Americans sick, more than 230,000 hospitalized, and over 9,300 dead. Older adults have absorbed the worst of it. 166.8 per 100,000 is the cumulative hospitalization rate for adults 65 and older, the highest of any age group, and the second highest rate at this point in any season since 2010-2011. What's driving the severe season comes down to one word: H3N2. Influenza. H3N2 dominates this year, accounting for nearly 88% of all subtyped viruses, and here's the detail that matters most. More than 90% of these H3N2 viruses belong to something called subclade K, a newly emerged variant carrying 7 mutations that help it slip past existing immunity. New York detected this subclade K variant first, back in June 2025. That timing created a problem because vaccine strains had already been selected in February, and we'll talk more about what that means for vaccine protection later in this video. One pattern the CDC has been clear about: H3N2 dominant seasons historically hit older adults hardest. Their exact words are that H3N2 predominant flu seasons have been associated with more flu-related hospitalizations and deaths in people 65 years and older. And that brings us to an important question about why age makes such a difference. Why seniors face higher risk? Let me share some numbers that put this in perspective. 70 to 85% of seasonal flu-related deaths occur in people 65 and older, according to CDC estimates. Hospitalizations follow a similar pattern, with 50 to 70% happening in this same age group. Working-age adults face a hospitalization rate that's 8.5 times lower than adults 65 and older. The mortality rate gap is even more striking. Adults 65 and older face a death rate approximately 38 times higher than adults 18 to 49. None of this is meant to frighten you. Understanding these numbers helps explain why taking this season seriously matters. Age makes such a difference because of something called immunosenescence, a term describing the progressive deterioration of immune function that happens as we get older. Our bodies produce fewer naive T cells over time, antibody production becomes impaired, and our overall capacity to mount strong immune responses against new threats decreases. Age-related immune changes aren't the only factor at play here. By age 65, approximately 65% of adults have 2 or more chronic conditions, and by age 85, that number rises past 80%. Heart disease, diabetes, COPD, kidney disease, each one of these conditions increases the risk of serious flu complications. During the 2024 to 2025 season, adults 65 and older accounted for 57% of all flu hospitalizations. Among those who ended up hospitalized, in-hospital mortality reached 4.5% for adults 75 and older, and 3.3% for adults 65 to 74. Understanding this risk isn't about fear. Taking appropriate action starts with knowing what to look for. Recognizing flu symptoms. Most of you probably know the standard flu symptoms: fever or feeling feverish with chills, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue, and sometimes vomiting and diarrhea. Here's something most people don't realize. Flu often presents differently in older adults. The CDC and the National Institutes of Health point out that seniors often do not manifest fever, or they experience what's called a blunted fever response. Many people use fever as their primary indicator that something is wrong, and that's where the danger lies. Waiting for a high fever to confirm the flu might mean waiting too long. Medical guidelines offer specific numbers about temperature in older adults. Normal body temperature runs slightly lower as we age, which means any of the following should raise concern. A single reading above 100 degrees Fahrenheit, multiple readings above 99 degrees, or a rise greater than 2 degrees above your normal baseline. Beyond the fever question, older adults may experience what doctors call atypical presentations. Mental status changes or confusion show up often, especially in frail or institutionalized elderly, along with increased lethargy, a sudden decline in the ability to do things you normally do, and worsening of existing chronic conditions appearing as the initial symptom rather than traditional flu symptoms. Another difference worth knowing: cough and malaise can persist longer than 2 weeks in older adults, which stretches longer than typical recovery in younger people. Paying attention to changes in how you feel overall matters more than checking for classic flu symptoms alone. Emergency warning signs. Now we reach the point where flu symptoms cross the line into a medical emergency. This information could save your life or the life of someone you love. The CDC lists specific emergency warning signs in adults that require immediate medical attention: difficulty breathing or shortness of breath, persistent pain or pressure in the chest or abdomen, persistent dizziness, confusion or inability to arouse, seizures, not urinating, severe muscle pain, severe weakness or unsteadiness, and fever or cough that improves but then returns or worsens. That last one deserves special attention because starting to feel better and then suddenly getting worse again signals a red flag. Worsening of chronic medical conditions also counts as an emergency warning sign. For seniors specifically, additional red flags include lethargy, confusion about who you are or where you are, blue lips or face, inability to perform usual activities like walking to the bathroom, and signs of severe dehydration. 2 specific complications can develop from flu, and both deserve attention. Pneumonia ranks among the most dangerous flu complications, and in elderly patients, it may show up without the typical fever, cough, or chest pain you'd expect. Altered mental status and sudden functional decline might appear instead. Someone who was doing fine yesterday becoming suddenly confused and unable to do things they normally do warrants immediate medical attention. Sepsis is another life-threatening complication, with warning signs including hypothermia and cold, clammy skin, rapid heart rate, rapid breathing, sudden confusion, extreme weakness, and skin discoloration. Here's a sobering fact: every hour of delay in sepsis treatment increases the risk of death by up to 8%. Time matters in ways few other things do. Flu can also trigger cardiac events, worsen heart failure, destabilize diabetes control, and cause COPD or asthma exacerbations. Any of these warning signs means seeking emergency medical care immediately, not waiting to see if things improve. Prevention strategies. Now let's shift to what you can do to protect yourself. Several evidence-based strategies exist that can reduce your risk. Vaccination comes first and most important, and we'll cover that in detail in the next section. Beyond vaccination, hand hygiene remains one of your best defenses. Washing your hands with soap and water for at least 20 seconds does the job, and when soap isn't available, an alcohol-based hand sanitizer with at least 60% alcohol works as a substitute. Respiratory hygiene means covering your mouth and nose with a tissue when you cough or sneeze, disposing of tissues immediately, and coughing into your elbow if no tissue is available. Avoiding exposure when possible makes a difference too. Keeping your distance from people who are sick, avoiding touching your eyes, nose, and mouth, and staying home if you're sick all reduce transmission. Return to normal activities only when your symptoms are improving overall and you've had no fever for at least 24 hours without using fever-reducing medication. Environmental measures help as well. Cleaning frequently touched surfaces like doorknobs, keyboards, and handrails removes virus particles, while improving indoor air quality through ventilation, air purification, and gathering outdoors when possible reduces exposure. The CDC notes that wearing a mask represents an additional prevention strategy that you can choose to further protect yourself and others. Keeping your chronic conditions well controlled, whether that's heart disease, diabetes, COPD, or kidney disease, reduces your vulnerability to flu complications. The CDC emphasizes that worsening of chronic conditions functions as both a complication of flu and a warning sign during flu illness. Vaccine recommendations. Now we arrive at one of the most important sections of this video: vaccines. An important clarification needs to come first. The CDC's preferential vaccine recommendations apply specifically to adults 65 years and older, not 60 and older. For adults 60 to 64, any age-appropriate flu vaccine is recommended without a specific preference, which means if you're between 60 and 64, any flu vaccine approved for your age represents a good choice. Adults 65 or older should listen carefully because 3 vaccines carry preferential recommendations from the Advisory Committee on Immunization Practices. No preference exists among these 3. and all are considered excellent choices for seniors. Fluzone High Dose comes first on the list. This vaccine contains 4 times the antigen of standard vaccines, 60 micrograms per virus compared to the standard 15. A randomized trial involving nearly 32,000 adults, 65 and older, published in the New England Journal of Medicine, found it 24% more effective against laboratory-confirmed flu than standard dose vaccines. Fluad, an adjuvanted vaccine, is the second option. It contains something called the MF59 adjuvant, a squalene-based compound that boosts your immune response. Observational studies have found it provides greater protection against flu-related hospitalizations. Flublok, a recombinant vaccine, rounds out the 3 options. It contains 3 times the antigen of standard vaccines and is egg-free, making it suitable for those with egg allergies. A retrospective cohort study involving 12.7 million adults 65 and older found it more effective than standard dose vaccines for preventing hospital visits. Recent large-scale research confirms these vaccines make a real difference. The Flunity HD study included nearly 500,000 older adults and appeared in The Lancet in October 2025, finding that high-dose vaccines provided nearly 32% additional relative protection against flu-specific hospitalization compared to standard-dose vaccines. The DanFlu-2 trial showed high-dose provided 44% better protection against flu hospitalization, with benefits most pronounced in adults 75 and older where the additional effectiveness reached 54%. One important change for 2025-2026. All flu vaccines are now trivalent, meaning they protect against 3 strains rather than 4, reflecting the extinction of the B. Yamagata lineage. Now for the subclade K variant and whether the vaccine still works. Only about 4% of H3N2 viruses are well recognized by current vaccine antisera, which sounds concerning until you look at what the research actually shows. A University of Pennsylvania study from January 2026 found that before vaccination, only 11% of people carried antibodies against subclade K. After vaccination, 39% had antibodies, nearly quadrupling the protection rate. The vaccine is clearly doing something beneficial, even against this mismatched strain. Dr. Angela Rasmussen, a virologist at the University of Saskatchewan, explained it this way. This confirms the vaccine still can offer better protection against H3N2 than if you were unvaccinated, and the mismatch may not be as impactful as everyone feared. Early UK data suggests vaccine effectiveness of 32 to 39% against hospitalization in adults, falling within typical ranges despite the subclade K mismatch. Professor Bill Hanage from Harvard School of Public Health put it well. It's more evidence that the current vaccine might not be perfect, but it's still more than good enough to provide protection, especially when it comes to stopping serious illness. Regarding timing, the CDC recommends vaccination in September or October for most adults, particularly those 65 and older. If you haven't been vaccinated yet, it is not too late. Vaccination should continue throughout the season as long as flu viruses circulate. When to see a doctor. This brings us to a critical question about when you should call your doctor. The answer turns out simpler than you might think. Adults 65 or older should call their healthcare provider immediately upon developing flu symptoms. Not tomorrow, not after waiting to see if it gets worse, but immediately. Timing matters this much because antiviral medications work best when started within 48 hours of symptom onset. After that window closes, effectiveness drops. Though benefits have been observed even when treatment begins later, particularly for hospitalized patients or those at high risk. The CDC makes an important point about waiting for test results. Decisions about starting antiviral treatment for patients with suspected influenza should not wait for laboratory confirmation. Your doctor doesn't need a positive test to start treatment. Dr. William Schaffner from Vanderbilt University summarized it perfectly. We can give you medicine to keep you out of the hospital, but you have to act quickly. Let me walk through the antiviral options your doctor might prescribe. Oseltamivir, which you probably know as Tamiflu, is the most commonly prescribed antiviral, with a standard dose of 75 milligrams twice daily for 5 days. Studies show it reduces symptom duration by approximately 1 day, lowers pneumonia risk by 50%, and significantly decreases death risk within 15 days of hospitalization. Baloxavir, sold as Xofluza, offers single-dose convenience. Dr. Tim Uyeki, Chief Medical Officer of the CDC's Influenza Division, stated that for patients, every patient would prefer a single oral dose of Baloxavir versus 5 days, twice daily of oseltamivir treatment. That said, it's not recommended for hospitalized patients due to limited data in that setting. Zanamivir, or Relenza, is an inhaled medication and is not recommended for people with breathing problems like asthma or COPD, conditions that are common in seniors. Peramivir, sold as Rapivab, is given as a single IV dose when oral medications cannot be taken. Here's reassuring news. All of these antivirals remain effective against the subclade K variant. What the experts are saying. Throughout this video, I've shared data and statistics, but I want you to hear directly from some of the experts who study influenza. Dr. Andrew Pekosh from Johns Hopkins Bloomberg School of Public Health explained that H3N2 is generally considered more severe across all ages, but especially among the elderly and young children, and that we're at the beginning of what will probably be a pretty severe influenza season, driven primarily by this subclade K virus. Dr. Michael Phillips from NYU Grossman School of Medicine was direct. There's no doubt about it, it's an unusual season, it's been severe, with a rapid onset. The CDC has also offered important reassurance through their official statement. Right now, there is no evidence to suggest that influenza A H3N2 subclade K is associated with more severe illness. The virus is spreading widely, but it doesn't appear to cause worse disease than other H3N2 variants. Dr. Lawrence Ma, a geriatrician at Stanford University, offered perspective specifically for older adults. Our biggest job as geriatricians is keeping people safe from falls, safe from accidents, from abuse, and safe from illnesses that won't be as severe. Vaccines may not prevent you from getting sick, but they prevent you from getting really sick. That last point deserves emphasis because the goal of vaccination isn't necessarily to prevent all infection, it's to prevent serious illness, hospitalization, and death. Dr. Dorothea Vafiatis, Senior Director of the National Council on Aging Center for Healthy Aging, summarized the practical advice. At NCOA, we encourage everyone, especially older adults and those with underlying health conditions, to talk with their healthcare provider about their personal risk and the best steps they can take to stay protected this season. Bringing it all together, let's return to where we started. The 2025-2026 flu season has already become one of the most significant in recent memory, with doctor visits for flu-like illness reaching levels not seen in nearly 30 years. Adults 65 and older face hospitalization rates 8.5 times higher than working-age adults and account for 70 to 85% of flu deaths. Here's what I want you to take away from this video. These risks are manageable. Adults 65 or older should get vaccinated with one of the 3 preferentially recommended vaccines: Fluzone High Dose, Fluad, or Flublok. Adults between 60 and 64 benefit from any age-appropriate flu vaccine, which still provides valuable protection. Practicing good hand hygiene, avoiding close contact with sick people when possible, and keeping your chronic conditions well managed all reduce your risk. Knowing the symptoms to watch for matters, and remember that in older adults, flu doesn't always look like the classic textbook case. Pay attention to confusion, sudden weakness, or worsening of your usual health conditions. Knowing the emergency warning signs matters just as much. Difficulty breathing, chest pain, persistent confusion, fever that improves, then returns, and signs of dehydration. Most important of all, if you develop flu symptoms, call your doctor immediately and don't wait. Antiviral treatment within 48 hours can keep you out of the hospital. As of mid-January 2026, no shortages have been reported for the high-dose, adjuvanted, or recombinant vaccines. They're available. Despite the emergence of subclade K and partial vaccine mismatch, the evidence clearly shows that vaccination provides meaningful protection against serious outcomes. Flu doesn't have to mean hospitalization. It doesn't have to mean weeks of misery. It certainly doesn't have to be life-threatening. Taking action is what matters now. Talk to your doctor, get vaccinated if you haven't already, and if symptoms appear, don't wait to seek care. Thank you for watching. Take care of yourselves, and I'll see you in the next video.